My name is Azia Harris-Martin. I'm a PhD student at the University of Michigan in the Department of Learning Health Sciences. This summer, for my summer learning project, I focused on evaluating system-level crisis management from the perspective of home health care providers and administrators. My research mentor for this project was Dr. Sue Ann Bell out of the School of Nursing, Department of Systems, Populations, and Leadership. This project was supported by the University of Michigan Institute of Healthcare Policy and Innovation, also known as IHPI.
My grandparents are similar to many other Medicare-eligible senior citizens. This is Ms. Sharon, their home health aide. She comes in 3 times a week to assist them in daily routine activities. In 2021 alone, in the U.S., 15 million patients received more than 600 million home health care visits. With a growing elderly population in the U.S., the demand for home health care is growing. However, when disaster strikes, the usual routine of a home health care aide can change in the blink of an eye, and they, along with their patients, are forced to adapt to the circumstances.
The approach to disaster, crisis, and emergency management can be thought of in 4 phases: mitigation, preparation, response, and recovery. There are over 9 ways to classify a disaster. This summer, I focused on geophysical and biological. The geophysical events that I focused on were from hurricanes, Hurricane Irma and Harvey, both of which occurred in 2017. The data was collected between the end of 2017 to mid-2018. Those were 5 focus groups and about 20 interviewees, all collected by Dr. Bell and her team. I also had access to COVID pandemic data, which was collected between August and October of 2020. That was individual interviewee style, and there were 28 of those that I had access to. So my initial project timeline, I thought about focusing on kind of data exploration and uploading for 1 week, and then drafting an initial analysis plan, and then focus the bulk of my time on analysis. And then at a high level, thought I would have something that could be publishable, whether it was like an op-ed or something small. That is not what occurred this summer. I ended up focusing a lot of time on kind of iterating through my initial data analysis plan and my initial data analysis. And that also helped me become a stronger qualitative researcher. What I hope to do is by the end of fall 2022 to draft a publishable manuscript. So the focus for my methodology, it was secondary qualitative analysis. And I used abductive and interpretive phenomenological structured methods using the disaster management cycle as well as CFR 2.0. So what I first did was read through the transcripts, then I drafted a code book, then I kind of assessed the major themes and links to the disaster management cycle. So thinking about what a home healthcare provider said and how it may have related to preparation or mitigation or response or recovery. And then I looked through those transcripts again and then assessed the major themes and links to the CFR domains or constructs. So inner, outer, implementation, innovation, the major domains within CFR 2.0. And then from there, I kind of narrowed down the scope so that I would really be able to assess the barriers and facilitators of the implementation of disaster crisis management in home health. So I decided to focus, after looking through the themes and talking with Dr. Bell, on the inner setting and available resources, thinking through staff, space, and systems. So my hypothesis and the reason I chose that construct is that resources and the availability of them are the most significant for the implementation of emergency management. The lack of critical resource or the abundance of critical resource can be a major barrier or facilitator. So there were a lot of quotes that talked about resources and supplies and also staff. A couple of them that you see here on the screen, which you can pause and read. So from my initial results, what I was able to gather is that during times of disasters, whether they are geological or biological, the availability of resources are a significant barrier or facilitator. I also realized that disasters create a lot of instability, both for individual, organizational, and environmental. Disasters also exacerbate the underlying diseases and social needs of patients. Disaster recovery can be multidimensional, both mental, physical, and emotional. And there's also a high need for coordinated community, national, and federal organizational assistance during disasters. So my future research and where I hope to take this is to connect the learning health cycle with the emergency disaster management cycle. I think there's a lot that we can learn within healthcare from COVID-19 pandemic and also previous disasters to apply them and move really from knowledge to performance and preparing us and mitigating the next disaster. So I would like to thank the Medical School Learning Health Sciences Department, the Institute for Healthcare Policy and Innovation, as well as the School of Nursing for supporting this project.